There are more and more resources, both in cancer centers and in big pediatric programs, as well as on the web, for adult survivors of childhood cancer, including childhood Hodgkin's disease. There are guidelines even for how someone who's exposed to these drugs or this radiation should be followed. And they're available on a website, www.survivorshipguidelines.org. The nice part about that guidelines, that page, as you'll also see if you look, a series of patient teaching sheets where you can print out a sheet that if you've gotten a certain drug or a certain radiation field or a certain complication, you can actually look for that particular teaching sheet, and it's very nicely done in lay language and kept updated by the national group that looks at cancer survivors. Locally, we have a childhood cancer survivor clinic where we see survivors of childhood cancer, even though they're adults. One of the nice things about that clinic is that we are able to do multidisciplinary work, so we're able to have a psychologist, for example, as well as an expert in oncology. Sometimes we bring in other experts, like an endocrinologist who might deal with thyroid disease, which is rather common in people who've had radiation to the neck or to the chest. And other centers may have that very same kind of multidisciplinary clinic. A way to look for that is obviously to do a web search at your local cancer center to look to see if they have a childhood cancer survivor program there. But most pediatric oncology programs can guide a person, even if you weren't treated at a particular center. I would look for a pediatric oncologist who can guide you to the place where childhood cancer survivors are seen.